Over 500 discharges each and every day, successful discharges. This case is very concerning. It is very concerning, and I don't want to diminish that. And I do feel for the individual, if he felt he was going to a different level of care that he actually was getting, because this was obviously listed as a non-medical care housing. And my understanding is that was the assessment that was given to the individual. I am actually working, as I said earlier, with Seniors Community and Social Services, because they have a breadth of knowledge of what the services are out there and the quality of the services out there. But that being said, this particular nonprofit agency that is providing non-medical care, non-medical housing, is actually not one that either myself in Alberta Health or Alberta Health Services or Seniors Community and Social Services is familiar with. So no, they will be removed off the list. And in fact, we will be reviewing the whole list that currently exists out there and making sure that those that are on that list, those vendors or those agencies, those providers, are actually ones that we can, because there is an implication that because they're on a list that we have actually approved them. And I wanted to be very clear, I was very clear in all of my communications over the last couple of days that we have not accredited that agency.
There is an iterative process, so at different times there can be different options presented, and to the extent that that constitutes a list, I think it also, it changes and evolves, and what I've learned as well is that with the social workers, they also have a community of practice, and they're sharing information, they're sharing feedback about what they are learning about different providers, so that as much as possible what they know they can bring to individuals. In cases, and the minister has said this, in cases where we find that a provider has not maybe followed through with what they committed to do, so that obviously has an impact on the extent to which a social worker will offer it, if at all, and that's information typically that would be widely shared. And in this case, obviously there will be even further review.